Hel- Hello everyone, welcome to GrowMed. Welcome back to the session where we are discussing the 100 most important topics. And so this is the part 4 video, okay. And so without wasting much time, and I'll not speak so much as you all know the context of the video and also without wasting much time, let's get started. See, cardiac tamponade is an important topic. Most common cause is the iatrogenic. Iatrogenic मतलब कि डॉक्टर की गलती, मतलब ऐसे नहीं बोलना चाहिए. मतलब कोई भी कुछ हो जाता है ना सर्जरी के टाइम पे, कुछ मिस्टेक हो जाती है डॉक्टर की, उसकी वजह से. ठीक है, तो iatrogenic. अदर कॉज ऑफ द ट्रॉमा और द ट्यूमर. ठीक है, तो क्लिनिकल केस में मोस्टली दिल बी डिस्क्राइबिंग लाइक द ट्रॉमा. ओके, सो ट्रॉमा के केस में होगा कार्डियक टैम्पोनेट. देन द क्लासिकल फाइंडिंग द बैक्ट्राइड, कंजेस्टेड नेक वेन्स, मफल्ड बीपी एंड muffled heart sounds and hypotension BP. Okay, so whenever these three things are described in the case, तभी ही cardiac tamponade करके मार्क करना, वरना ना और भी दूसरी कंडीशन है जिसमें ना यू कैन सी कंजेस्टेड नेक वेन्स, बस कंजेस्टेड नेक वेन दिखेंगी, किसी किसी में मफल हार्ट साउंड दिखेगी. ठीक, अगर तीनों एक साथ प्रेजेंट है देन मार्क इट एज द कार्डियक टैम्पोनेट. देन JVP पे you can see steep X and Y, so important finding. And ECG पे electric alterance. Chest X-ray पे you can see a money bag appearance. This is also important. रेडियो के इंटीग्रेशन में पूछ सकते हैं. एंड ट्रीटमेंट पे रिकार्डियोसेंथेसिस. Then pharyngeal arches, so its derivatives. You can expect one question from this also क्योंकि हर एग्जाम में this question have been asked on the pharyngeal arches. ठीक है, so questions are asked on its derivatives. So for arches 1 to 3 and 4 and 6 होना चाहिए ना, ये this should be the 6 one, not the 5. Okay, then 1 to 3 4 and 6, and first one is supplied by the cranial nerve 5 3. Then the blood vessel derived is the maxillary. So two derived matlab nerve supply by the facial nerve, and the blood vessel derived the stapedial artery. So this was a PYQ. Then for the 3 it is the vagus, and for 4 it is the uh, sensory nahi, superior laryngeal nerve SNL, and for the sixth it is the recurrent laryngeal nerve. So these two are important. जो ये blood vessels है ना, this one pulmonary artery ductus arteriosus and the arc of aorta. So these blood vessels derivatives are also important. And then these are the other various structures which are derived from the particular pharyngeal arches. Like once they will be coming malleolus, incus, muscles of the mastication, then tensor tympani and tensor valley palatae muscle, anterior belly of the digastric, and the amliohyoid. Okay, so this is a PYQ. The malleus is a PYQ. The stapes is a PYQ coming from the second. Then posterior belly of the digastric. This is also important क्योंकि digastric muscle has two bellies, na, anterior and posterior. Anterior will be coming from one, posterior from the two. Then stylohyoid and the myohyoid. So one mnemonic to remember this thing is that the pharyngeal arch one, so all the derivatives are remembered by the name W, and for second it will be the S. So MS maxillary हो गया, mandibular nerve हो गया, malleolus muscles of mastication हो गया, mylohyoid हो गया. Okay, so most of the derivatives come from the M, and in the S it is the stapedial artery, then stapes, then stylohyoid, ऐसे करके. Okay, so facial nerve, the facial expression, muscles of the facial expression. Okay, then remaining three will be giving the muscles of the larynx, pharynx, and the palate. Okay, so easy, right? Pharyngeal arches इतना कुछ है नहीं, बस look at the things one to two time and you'll be easily coming to know कि you'll easily remember the things. Then moving on to the ABG analysis. So a must know topic, and again you can expect a one question from this one ABG analysis. Okay, so they can describe a clinical case or simply just give the values, and they'll ask what type of uh, change is there, whether it is alkalosis or acidosis. So these are the normal finding which you must look in the question, and you must remember these things like by heartly. आपको याद होना चाहिए. pH 7.35 to 7.45, CO2 35 to 45 के बीच में रहेगा, and bicarbonate these 22 to 26. If the pH reduces, then it will be called as the acidosis, whereas if increases, alkalosis. Then If the changes are seen in the carbon dioxide, then it will be the respiratory, and bicarbonate will be the metabolic acidosis. So these are the three important basic things which you must remember, and by looking at this you can easily remember. If you remember this, no, you can easily come to the conclusion कि क्या पूछा जा रहा है question में. Like in case of the metabolic acidosis, तो पहले we will discuss like this. तो मेटाबॉलिक मतलब क्या, बाइकार्बोनेट की चेंजेस हो रही है ना, बाइकार्बोनेट की चेंजेस है, एसिडोसिस में पीएच की चेंजेस हो रही है, पीएच क्या हो रहा है, कम हो रहा है. एंड वन थिंग यू रिमेंबर दैट मेटाबॉलिक में सेम की तरफ जाता है, तो अगर पीएच भी कम है तो बाइकार्बोनेट भी कम होगा इसमें, एज यू कैन सी हियर. ठीक है. देन अल्कलोसिस में क्या हो रहा है, पीएच इंक्रीज हो रहा है. तो फर्स्ट द ट्रिक टू सॉल्व दिस क्वेश्चंस इज फर्स्ट ऑलवेज लुक एट द पीएच वैल्यू. तो फर्स्ट सी की पीएच वैल्यू कितनी है, वेदर इट इज अल्कलोसिस or the acidosis. Then after that look at the CO2, then look at the bicarbonate, or look at the bicarbonate or the CO2, whichever you're comfortable, and after that come to the conclusion which kind of change is seen. So in metabolic क्या होता है कि पीएच तो बढ़ गया है ना, अल्कलोसिस इज इंक्रीज, तो मेटाबॉलिक में देर बी चेंजेस इन द पीसीओ2, तो पीसीओ2 मेटाबॉलिक है ना, नहीं सॉरी बाइकार्बोनेट, बाइकार्बोनेट है ना, तो मेटाबॉलिक में इट विल बी रेड्यूस्ड एंड सॉरी इंक्रीज होगा ना, सेम जाएगा, सेम की तरफ जाएगा. इन मेटाबॉलिक द चेंजेस विल बी अकरिंग in the same direction as the pH, whereas in case of respiratory the changes will be opposite to that of the pH. मतलब देखो एसिडोसिस हो रहा है ना, pH कम हो रहा है, बट इसमें क्या होगा कि CO2 इंक्रीज होते जाता है, इंक्रीज होगा, एंड रेस्पिरेटरी में CO2 कम होगा. ओके. So this is how you will be uh, solving the questions related to the ABG analysis, and this is a mnemonic also to remember. Rome, respiratory opposite, metabolic equal, मतलब same direction. Then twin pregnancies, so OBG, and it is a very important topic. So uh, questions are asked like on the types of the twin pregnancies. So we all know that ना two type की रहती है, monochorionic, dichorionic. So questions are asked like cleavage, on which day they cleave and which twin is formed. So if it divides on day 1 to 3, it will be forming dichorionic, diamniotic. If day 4 to 8, monochorionic, diamniotic, and 8 to 13, monochorionic, monoamniotic, and day 13 to 15, conjoined twins. Okay. So this is the thing which you must remember from the twin pregnancies, and also there are various other findings seen in the twin pregnancy, like the USG findings, the lambda sign, and the twin peak sign, which will be differentiating between the monochorionic and the dichorionic. Okay, then moving on to some important so nephropathies and the नेफ्रोटिक एंड द नेफ्राइटिक सिंड्रोम. ठीक है, तो बहुत ज़्यादा इंपॉर्टेंट है ये, एंड पैथो की इंटीग्रेशन में फ्रीक्वेंटली क्वेश्चंस हैव बीन asked on this. So the first image is of the image nodular glomerulosclerosis, also the Kim Milston Wilson's disease, and a classical finding with the diabetic nephropathy. Okay, so this was a PYQ asked that which of the following is a classical finding seen with the diabetic nephropathy, and it was the KW ring, KW sclerosis. Okay, so you can see here in the image the particular nodules, they have undergone the sclerosis, and due to which it will be affecting the filtration of the kidney. ठीक है. Then moving on to the membranous nephropathy. So membranous nephropathy में you can see uniform diffuse thickening of the glomerular capillary wall. See, this is the glomerular apparatus, right? This is the whole glomerular apparatus, and these are the capillaries which are present in it. And you can appreciate that all the capillaries have increased in the size. So diffuse thickening of the capillary walls can be seen. I should have attached a normal patho, मतलब क्या जो ग्लोमेरुलस की नॉर्मल वाली फोटो है, आई कुड हैव अटैच दैट सो दैट यू गाइज विल बी easier to understand you, but I forgot that. So just remember this image ki membranous nephropathy, uniform diffuse sclerosing, thickening of the glomerular capillary wall. Then RGPN, so you can see a crescent shaped mass here. ठीक है, तो clearly appreciated है ना this crescent shaped mass here. So this is the whole glomerular apparatus, and you can see here these are the blood vessels, and you can see here the moon shaped mass. Then PSGN, where you can see proliferating capillaries plus hypercellular glomerulus. Okay, so this is the glomerulus, and you can appreciate it that मतलब बहुत सारी cells visible है ना. It is hypercellular, and PSGN is the most common type of the nephritic syndrome in the children. So clinical case describing child hematuria and edema with the history of sore throat. Think in terms of the PSGN. Okay, so this is very important topic and a repeat topic, the PSGN. Then FSGN, so it is a focal segmental glomerulonephritis. That means a single segment is only sclerosed. See, all these are the normal capillaries. Only one segment is undergone sclerosis, and this pattern is called as a focal segmental. This is the most common type of the nephrotic syndrome in the adult. So in the question, do look at the things which are described like nephritic and the nephrotic, because these are very confusing, and even if you miss one word, then the question can be wrong. Then associated with the HIV, SCA, sickle cell anemia, and the reflux nephropathy, मतलब कि vesico ureteric reflux, ठीक है. Then moving on to minimal change disease. तो minimal change disease में what happens is that हाँ, यहाँ पर लिखा तो है लाइट माइक्रोस्कोपी पे देयर विल बी नो एब्नॉर्मलिटीज सीन, मतलब लाइट माइक्रोस्कोपी में द ग्लोमेरुलस विल बी अपीयरिंग नॉर्मल, बट अगर इफ यू डू द इम्यूनोफ्लोरोसेंस देन यू कैन सी द चेंजेस इन इट, एंड सी दिस इज द चेंजेस विच यू कैन सी on the uh, this effaced podocytes. Effacement of the podocytes can be seen, and this is the hallmark feature of this minimal change disease, most common type of the nephrotic in the children. And if a clinical case is described, then they can be describing these things like the edema, proteinuria, and the effacement of the podocytes. When you see these findings in the question, then go with the minimal change disease as the answer. Then moving on. So cryptococcal meningitis. So cryptococcal meningitis is also very important, and we have already discussed about it, right? Meningitis में we had discussed about it all the things. Okay, तो वही वाली सारी चीज़ें यहाँ पर अभी repeat की गई है, तो I will be skipping this part, the cryptococcus. Okay, then moving on to the corynebacterium diphtheria. So this is a repeat topic, and this image, I don't know why this is the favorite question of the examiners. Okay, so this is also called as the Klebsiella bacilli. It is a non-sporing, non-motor, and non-capsulated. So the things which you must remember from this one is the Chinese letter appearance, this figure, and cuneiform arrangement of the spores. Okay, then the granules are described like metachromatic, poly, metaphosphate, volene, and the bulbs are nest granule. So the stains, this is a PYQ, so you need to remember the stains. Ponders, albone, and the nisers, which would be staining the uh, granules green in color. So these are the stains for the granule, and you need to like really mug up these things. Then clinical features, pseudomembrane, most common on the tonsillar surface. So you can see here the pseudomembrane, and the classical finding described with this is the gray membrane which bleeds on touch. So whenever you see this thing described in the question, no, just straight away mark the answer as the diphtheria. And the pathognomic feature is the बुल्स नेक. ओके, सो मतलब बुल्स नेक की भी फोटो तो मैंने इसमें नहीं लगाई है. ओके, बट बुल्स नेक विल बी लाइक स्वेलिंग इमेज, किसी भी चाइल्ड की इमेज दे देंगे, एंड दिल बी अ स्वेलिंग इन द कहाँ नेक में दिल बी अ स्वेलिंग टुवर्ड्स वन साइड गिविंग द appearance of the bull neck, and this is the pathognomic feature. Then for the lab diagnosis, for the demonstration of the toxin, we will be doing the LX gel precipitate test. So this was a PYQ, simple one liner was asked that for demonstration of the toxin of the diphtheria, which test you will be doing. Then these are the media culture, enriched media, Loeffler's serum slope, and selective is the PTA, potassium telluride agar. Okay. Then the Suraksha clinic. So the Suraksha clinic, it is a clinic for the sexually transmitted diseases, and these are the various kits which we will be providing for the patient, and you need to like mug up this whole table. मतलब रटना है इसको कि कौन से डिसीज में हम कौन सा वाला किट देंगे, लाइक ग्रे विल बी गिविंग फॉर यूरेथ्रल एनोरेक्टल सर्वाइकल डिस्चार्ज। तो मैं इंपॉर्टेंट वाले बता देती हूँ इसमें जो पीवाईक्यूज पूछे गए थे। पीआईडी, दिस इज अ पीवाईक्यू एंड अ क्लिनिकल केस वाज आस्क्ड दैट अ फीमेल विद वजाइनल डिस्चार्ज एज वेल एज abdomen pain abdomen, so which we will be giving. So we are suspecting PID in that case, so we will be treating with the yellow. तो vaginal discharge देख के green mark मत कर देना, green will be just giving if there is vaginal discharge, but along with that the patient has abdominal pain also, no, so we will be giving the black color. Then yellow color, sorry, black is for the inguinal bubo. Okay, so this is the full table which you must by heart. And then this anemia mukt bharat is also a repeat topic, and questions are like repeatedly asked on this topic. So you need to mug up the whole age group and the iron and the folic acid, and this is the frequency when we will be giving it. Okay, so iron given in the mg and folic acid given in the micrograms. Okay, so this is the doses which you must remember. Then moving on to the antidotes and the drug toxicity, and this is also an important topic. तो comes in integration with a lot of subjects like pharma हो गया, फिर उसके बाद में कब forensic medicine में पूछ सकते हैं, किसी कभी कभी medicine में भी पूछ सकते हैं. Okay, so the antidote for the aspirin is the alkalinization of the urine, as this is an acidic drug. तो alkalinization करने के बाद में it will go out. Then amphetamine forced acid diuresis है. Then benzodiazepine flumazenil, this is a PYQ, and asked in integration with the psychiatry, तो benzodiazepine का. Then beta blocker glucagon, calcium channel blocker calcium gluconate, digoxin digibind. Then for the opioid will be naloxone. This one is a PYQ asked like repeated multiple times. Okay, so naloxone for the opioid, and they can also give the morphine, right? The morphine with the opioid ही है ना, तो they can confuse you with these terms. So question ध्यान से पढ़ना. And TCA, sodium bicarbonate, then methanol, fomepizole, this is also a PYQ. Paracetamol, N-acetylcysteine, organophosphate, atropine. तो पूरा clinical case दे देंगे ना organophosphate का, कि describing the features like meiosis वगैरह cause करता है ना ये. पैरास parasympathetic systems को I think this will increase, and yes, so yeah, so we will be blocking this by using the atropine. Then atropine की होगी तो we will be giving the physostigmine. Iron desferoxamine, तो classical case of the iron is the child. He consumed the tablets, iron tablets of the mother, and now comes to the emergency. What is the antidote? Desferoxamine. ठीक है, तो desferoxamine, this is also a repeat topic. Then vitamin A का it is warfarin. Warfarin का is vitamin K. Heparin का is protamine sulfate, lead EDTA, and for cyclophosphamide it is the mes. Okay, so this is a list of the important drugs and the antidotes which are used. Then moving on to the another important topic from the pharma, that is the anti-cancer drugs, usually the side effects. So the questions are asked on the side effects of these drugs. So let's look at them, and this is the classification. So complete classification and the side effect. So the PYQs asked from this one are these things: the ototoxic, nephrotoxic, vomiting, the peripheral neuropathy, and cardiotoxic. Then uh, pulmonary fibrosis caused by two drugs, bleomycin and the busulfan, and the hemorrhagic cystitis caused by the cyclophosphamide and the ifosfamide. This see, this side effect wala is important, but not that important. So it is important, but okay. uh, ठीक है, तो बस साइड इफेक्ट्स इसके अच्छे से देख लेना, एंड इफ़ यू हैव read all these things along with the mechanism of action, then so it is good. Then fundal height and the gestational age. So it will be in the pubic symphysis at the 16 weeks or the 16 weeks, I think. Pubic symphysis पे it will be at the 16 weeks. Then umbilicus 24, xiphoid process पे 36 week, and 40 weeks पे 1 to 2 finger width below costal arch. Best USG markers for the age of the fetus. The first trimester crown rump length, second biparietal diameter, and third femoral length. So this is also a repeat topic. The vaginal discharge, also called as the logia, so classified into the rubra, red, serosa, pink to brownish, and alba means white. So this is a normal physiological phenomenon, and it happens in almost most of the ladies. And this is like Normal, okay. So normal until it occurs for 3 to 4 days. Then serosa 4 to 10 and to 12 days to 3 weeks. Then Mullerian agenesis, so which is also called as the MRKH syndrome. So what happens in this syndrome is how you will identify it. तो Mullerian agenesis का मतलब तो क्वेश्चन में ही पता लग गया ना. एजेनेसिस मतलब नहीं बना, क्या नहीं बना? मुलेरियन डक्ट. मुलेरियन डक्ट नहीं बना तो उसकी डेरिवेटिव्स भी नहीं बनेंगी, जो कि है यूटेरस, फेलोपियन ट्यूब एंड द सर्विक्स. ठीक है, तो ये सारी चीज़ें एब्सेंट रहेंगी इन द फीमेल एंड द क्रोमोसोम विल बी 46 XX. तो सी, बट absent. Uterus and the fallopian tubes absent and ovaries are present, क्योंकि ovary आता है genital ridge से ना, तो that one will be present. And the features will be primary amenorrhea, axillary and pubic hair are present, and breasts are also present, but only the uterus and the fallopian tubes are absent, due to which the patient is complaining of the primary amenorrhea. And the age described for this primary amenorrhea will be somewhere between 16 to 17, and sometimes 18-year-old female also can be described. Then moving on to the vaginitis. So these are the three important things. Vaginal discharge mainly. So bacterial vaginosis, trichomoniasis, and the yeast infection, which is the candida. तो candida का classical finding है curdy white appearance, like discharge, curdy white discharge. And trichomoniasis का so this is a causative organism. ये तीनों इसके causative organisms है. And these are the type of the discharge seen. So yellow green frothy discharge and a gray or milk discharge. Clear. So जो bacterial vaginosis में रहता है ना, it will be like clear. So as you can see here in the image, तो ये clear है. This one is yellow green and this one is curdy white. And the important thing which you must remember is the fishy odor, whiff test positive, and the clue cell. So whenever these things are described in the clinical case, then the answer will be the bacterial vaginosis. Then moving on to the undescended testes. So we will be discussing some important topics from the surgery as well in this video, which are the repeat topics, and quickly I will be discussing the PYQs asked. So as undescended testes, so incident of birth, ये सारे important नहीं है, इतने don't look at these things much. ठीक है, तो spontaneous descent occurs by 3 months, and location, the palpable, non palpable, whether it is the inguinal अनडिसेंडेड और मतलब डिसेंड अच्छे से हुआ है या नहीं हुआ है, वेदर इट इज़ प्रेजेंट इन द इंग्वाइनल रीजन और द एब्डोमेन रीजन. ठीक है, तो ये भी उतना इंपॉर्टेंट नहीं है इसके लिए, एग्जाम के लिए. द थिंग विच इज़ इंपॉर्टेंट फॉर द एग्जाम इज जस्ट दिस वन थिंग. ठीक है, तो they will be describing a whole clinical case like a child. A mother was making him to bath, and while bathing, she felt the scrotum empty and brings to you the child. So when you on examination you find that the scrotum is empty and you see two palpable masses in the inguinal region या फिर कोई भी region, they can describe and they'll ask you what is the diagnosis. So it will be either undescended testes or the ectopic testes. So both can be. So you need to read the question very properly and then answer the question. And the questions are asked like when you will do the surgery. So the best time is the 6 months. So on 6 months we will be doing this orchidopexy. ठीक है, तो अनडिसेंडेड टेस्टिस का जस्ट इतना याद रखना और बाकी ये सब रखने की नहीं है याद ज़रूरत. Then vesico-urethric reflex. So this is also the most common congenital abnormality of the urinary tract, most commonly seen in the children, autosomal dominant. Then asymptomatic and it can resolve spontaneously, classified into two causes, primary and the secondary. So if it is primary, it will be like short intravesical length of the uterus and deficiency of the longitudinal muscle. So secondary में the children will be having posterior urethric wall. So this is a very important topic, posterior urethral wall. And investigation of choice is the MCU. So this is also a PYQ. V VUR MCU. ऐसे करके भी ये remember it ना, VUR MCU. VUR MCU. Then these are the grades and questions are asked on the grades also. So this is the images of the grade 1 2 3 4 and 5. तो grade 1 में क्या होता है कि it is reflux but not dilated uterus. So reflux into the pelvic alveolar system as you can see here. Then Mild to moderate dilation is seen. Then blunting of the fornix with reflex and their bilateral and tortuous ureter with reflex. See this one. So these are the gradings, and this is the management, how you will manage the patient. And for the treatment, you will be using the uretrovesicoplasty sting operation, ureteric reimplantation. Okay, so this image is also important because image based question can be asked. This grades is important, this treatment is not that important, so just remember the things which are star marked from this one. Then moving on to the Hirschsprung's disease. So the most common site involved is the rectum, and the second most is the sigmoid. So the pathology is the neurocrystinopathy, and you need to remember this one, absence of the uh, aganglionic cell. So this is also called as the congenital agangliomania, something like that. Okay. Then these are the clinical features which will be described in the clinical case, like meconium, delayed passage of the meconium, abdominal distension, and after that in 1 week you can see chronic constipation. And so yeah, these things will be described in the question. So the investigation of choice is the rectal biopsy, and this is the treatment modality. So the questions asked from this one are on this patho. Then the clinical case asking the disease or the diagnosis, so it will be easier. And then the investigation of choice is the rectal biopsy. So they can describe the whole clinical case which I just described right now, right? The child with delayed passage of the meconium and vomiting, and uh, which they can give the image also. So you can see the image of the dilated intestine, and they'll ask what is the investigation of choice, so it will be the rectal biopsy, or they can ask the diagnosis. Then the carcinoid tumor, so it is also a neuroendocrine tumor, arises from the crypt of lubricant. And the clinical feature, abdominal pain is the most common, and gastric carcinoid will be giving red, bright red patchy flushing. So the questions asked on this carcinoid tumor are on the investigation of choice. So it is the 5-HIAA in the urine, and the screening test. So the screening test will be the not the screening test. Sorry, the investigation of choice. It will be the 5-HIAA in the urine, and the treatment modality for this one, carcinoid tumor. Then the Muckle's diverticula, again a repeat topic, and so it is classified. These are the features of this Muckle's diverticula, that it is a true, it is congenital, single, and present on the anti-mesenteric border. I think a question was asked on this describing the features of this diverticula, and instead of anti-mesenteric, they had marked given the mesenteric border in the option, and you had to choose that one as the option answer. Okay, then this is the rule of two, as I think most of you already know about this diverticula. Then the investigation of choice is the technetium protectate, and then investigation of choice enteroclysis, and this is the treatment modality which you will be doing. And also image based questions have been asked on this Meckel's diverticula, so let me show you an image of this. Okay, so this is the image of this diverticula, and you can see here that how does it look. Then infantile hypertrophic pyloric stenosis. This is also a repeat topic, and the classical finding seen on the X-ray is the single bubble sign, as you can see here, and there will be obstruction present due to the pyloric stenosis. तो vomiting होगी पेशेंट में क्योंकि obstruction है ना, obstruction है, तो mainly ये सारी congenital conditions है, most commonly seen in the pediatric patients. Okay, so there will be non-bilious vomiting. Then uh, olive mass, palpable mass in the epigastrium, which can also be described like an olive shaped mass. So olive shaped mass, non-bilious vomiting, these all are the buzzwords that will be given in the clinical case. So you need to find these things, and then you'll be easily able to reach to the diagnosis that it is the pyloric stenosis. Then this is the investigation is, sorry, treatment of choice for this pyloric stenosis. So we will be doing the pyloromyotomy. Then moving on to this is the dyselectrolytemia seen in case of this pyloric stenosis, because there will be vomiting. Now, so whenever there is vomiting, there will be loss of the electrolytes, and this kind of electrolyte imbalance is seen. Hypochloremia, hypokalemia, metabolic alkalosis with paradoxical acid urea, and you need to remember this point. Then the gist. So the gastrointestinal tumors, pacemakers arises from pacemaker, which are the interstitial cells of the casal, and the marker is the keratin. So this is an important, and so wedge shape incision with 2 centimeter margin. We need to give this one for the treatment. And the other features like the extramural growth, bleeding is the most common presentation, and abdominal pain can be seen. Investigation of choice, the C is CT. Okay, so these are the important things from the gist. Then moving on to the congenital diaphragmatic hernia, and so this congenital diaphragmatic hernia, this is the classical image, as like most famous image of the Fmge. As you can see here, let's discuss the image first. So you can see here that the हार्ट और द लंग हैज़ मूव्ड टूवर्ड्स द राइट साइड, मतलब यहाँ पर थोड़ी सी वाइट कलर की है. एंड यू कैन सी हियर मल्टीपल एयर फ्लूइड लेवल्स इन द chest. These are the suggestive of the herniation of the intestine into the thorax, and these are pushing the contents towards the other side. So this is the features which are seen: respiratory distress, dextrocardia, and the scaphoid abdomen. Whenever you see these three things described in the question, mark the answer as the punctalic hernia or the congenital diaphragmatic hernia. Then chest X-ray here already discussed, and another important finding is the coiling of the release tube in the thorax. Okay, so these are the things. Then moving on to the neuroendocrine tumors of the pancreas. Okay, so this is an important topic, but all the things are not important from this one. So I'll just discuss the important things which you must remember. Okay, so these are the important one-liners asked, and you need to remember all these things, like which is the most common, which is the most common functional, that is the insulinoma, most common functional and malignant gastrinoma, and investigation of choice for the localization is the SRS. And in insulinoma, we can see the Whipple's triad. So this is a PYQ and important. You need to remember this one. Then gold standard investigation, 72 hours fasting. Okay, so these are the things from the insulinoma which you must remember. Then the gastrinoma Zollinger Ellison syndrome, and which is also called as the gastrinoma. So there will be increased levels of the gastrin causing increased acid causing peptic ulcer disease. So arises from the gastrinoma triangle, and this is the site. Duodenum is the most common site for the gastrinoma. So these are the clinical features. So whenever you see increased acid, so you can see retrosternal heartburn, dyspepsia, diarrhea, and the ulcers. And these are the diagnostic features which you need to look at. Like gastrin present more than 1000 picogram per ml, basal acid output 15, and secretin stimulation test, whereas investigation of choice, and we had already discussed. Then BP's I are the drug of choice, and treatment of choice is the pylorus preserving repulse procedure. So this was a PYQ asked that in case of gastrinoma, what you can do, the surgical method. Then go glucagonoma. So site is the body and the tail, and 4 Ds which you must remember: dermatitis, diabetes, mellitus, DVT, and the depression. Investigation of choice is the increase in the glucagon, and treatment distal pancreatectomy. Okay, then this one about the VIPoma, so also called as the various names. And what happens in this disease? There will be watery diarrhea, hyperkalemia, and a chlorhydria, and most common site is the tail. Okay, so these are the things from this VIPoma. Then moving on to the thyroid malignancies. So in case of the thyroid malignancies, this is very important chart, and I have tried to uh, cover all the things in a single chart. So the PYQs asked from this thyroid malignancy are about this one: the orphan NEI nuclei, which is the characteristic feature seen with the papillary, and this is the image. So the nuclei appears to be like empty and clear, so given the name of this orphan NEI. Then clinical cases can be described like a central midline swelling. Then investigation of choice is the FNSU. For almost all the thyroid tissues, the FNSC is the choice, investigation of choice for the thyroid malignancies. One exception is this one for the follicular, which you must remember. So then moving on to the another important PYQ, that is the calcitonin, which is the marker for the medullary thyroid malignancy, medullary cancer. And oh yeah, so this is the important thing. Then anaplastic पे ज़्यादा क्वेश्चंस पूछे नहीं जाते बिकॉज इट इज़ रेयर एंड दैट इज़ नॉट दैट कॉमन ओके, तो इसीलिए एनाप्लास्टिक पे इतने नहीं पूछे जाते क्वेश्चंस. And these are also the important things, like which all factors increases the risk of the papillary cancer: low dose radiation exposure, Hashimoto, and thyroglossal cyst. And the papillary and the follicular, these are a type of the well differentiated cancers. Okay, so that's all in this video, guys. So we have reached almost to the half, more than half of the PDF, and quickly I'll be posting 2 3 videos more discussing all the important things so that you do not miss any important one. Okay, so till then, stay tuned and join with me on the Telegram channel for more amazing things related to the FMG. All the best for the FMG, guys. Thank you so much. Bye bye.